really fortunate in Australia that there are not restrictions related to drug use, and therefore there are also not restrictions related to reinfection for treatment of hepatitis C. So if somebody is concerned about reinfection, we would absolutely provide them with all the means possible and all the tools possible to reduce that. But if they do become reinfected, they should know that if that's picked up, it can be retreated.
Unlike many other viruses where you acquire an immunity, for some reason with Hep C you don't. So as in my case, I had genotype 1A from mixed a number of years ago because I was just unaware of the concept of sharing equipment being a risky act, and then I acquired it again, embarrassingly, at a party where I thought I was in control of things, but I just wasn't. And so I got it again, and it was exactly the same genotype. So I got genotype 1A twice, but had treatment both times. And the second treatment, the new treatment, was remarkably better and got rid of the virus on both occasions pretty quickly.
Reinfection shouldn't be a bogeyman in terms of these treatments, but it's certainly well worth talking about. And I think also saying to a person, yeah, we know you're still using, and we don't want you to get reinfected, so here's all the things that we really want you to think about, but don't not have the treatment because you're worried you might get reinfected. Harm reduction to be effective, getting into the details of a person's injecting, I think is really important. And this is not just, do you share needles? No, I never do that. But do you ever reuse your own? In which case, is it possible that the one you think you're reusing might be somebody else's? And who do you inject with? Who else is around? Who's in the same room? Getting that idea through to people that actually washing their hands, using the alco wipes, not sharing tourniquets, not sharing a spoon, a cotton bud, any of that sort of stuff, making sure that they couldn't be mistaking somebody else's paraphernalia for their own. That's really detailed discussion. It takes time.
Harm reduction is a really important aspect of care of people who continue to inject. The sort of things that we're always keen to emphasise are a non-judgmental and free access to needle and syringe equipment, injecting equipment. Advice around safer injecting, I think, is really important. In people who are no longer injecting, to provide them with as much support with that as possible, but also acknowledging that sometimes drug use can be a relapsing condition, and that's not going to mean that they need to discontinue hepatitis C treatment or won't be offered retreatment in the future. A particular overlap in harm reduction in drug and alcohol with hepatitis C could be opiate substitution therapy. So we are particularly keen to offer people on opiate substitution therapy hepatitis C treatment, and obviously that has a harm reduction aspect to it as well. And I think crucially, acknowledging that people who continue to inject may inject in a social network. They may have a partner, a friend who they regularly inject with. They may inject in a group of people, and therefore, to reduce the risk of reinfection, we're really keen to ask that person to invite as many of their injecting partners to clinic as possible, so that we can reduce the chance they're reinfected.
In many cases, the majority of people that contract the virus don't share needles. So obviously it's the spoon or the tourniquet or the cotton filter, and yeah, because of that, we don't think that we're going to contract it. But yeah, the other important thing is you must get tested. Well, if you're in a risk category, every 6 months is a good idea, just to have peace of mind, and also that with STIs as well, you may as well get that sort of test as well.